If you're listening to this right now, there is a very good chance that you are deeply, intimately familiar with a very specific kind of exhaustion. We're talking about that bone-deep fatigue of living with chronic Lyme disease. You might be dealing with the brain fog that makes, just simple conversations feel like you're climbing a mountain.
Right, yeah.
Or the migrating joint pain, the sudden flare-ups, and maybe the hardest part, honestly, which is years of unanswered questions and confusing test results.
It's incredibly draining.
It is. And we know you aren't looking for miracle promises or like some slick sales pitch. You just want someone to look at the whole picture and help you understand your actual options.
Exactly. And before we get into the details of what those options look like, it helps to just set some clear guardrails for our conversation. So this deep dive is for educational purposes only. It is not medical advice, diagnosis, or a treatment recommendation. Anyone considering care abroad should speak with qualified healthcare professionals and review their personal medical history before making decisions.
Right. Good to get that out of the way. So our mission for this deep dive is to explore why some U.S. patients are looking across the border into Tijuana, Mexico for integrative Lyme disease treatment.
Yeah.
And we really want to gently walk through what that process actually entails because it's a massive step.
Yeah.
And it can feel incredibly overwhelming when your energy is already completely depleted.
It really can, yeah.
Yeah.
Grounding this in a human experience kind of brings those medical logistics into focus, I think.
I agree. So let's talk about, let's call her Emily. Emily is a fictional patient, but her story is built from the realities of so many people navigating this illness.
Right.
She has this thick, heavy folder sitting on her kitchen table. It's just a stack of old, borderline lab results, an extensive history of taking all these different rounds of powerful antibiotics. And she still has these lingering, confusing symptoms that just won't quit. She's tired of feeling like her pain is dismissed by local specialists or that her care is, fragmented into different departments that never talk to each other.
That's so common.
Yeah. So she starts researching clinics in Tijuana because she wants clarity and a cohesive plan. She isn't looking for a guaranteed overnight cure,
No, of course not. And the practical side of why patients in situations like Emily's look to Mexico, specifically Tijuana, often comes down to, well, a combination of accessibility and clinical freedom.
Right, because of the location.
Exactly. Geographically, it's just a short drive from San Diego. And that is a crucial factor for someone suffering from severe chronic fatigue.
Yeah, they simply cannot physically endure a long-haul international flight to, specialized clinics in Europe.
Exactly. But the more profound draw, honestly, is the regulatory environment there. Within these specialized health districts, licensed physicians are permitted to practice true integrative medicine.
Okay, so what does that mean practically for the patient?
It means they operate outside the rigid constraints of standard domestic insurance models, so they can combine advanced conventional medicine directly with holistic therapies.
I see. It sounds like Emily has been handed a dozen puzzle pieces from completely different boxes.
Oh, that's a great way to put it.
Right. She's got one piece from a rheumatologist focusing on her joint pain, one from an infectious disease doctor focused on standard antibiotics, maybe one from a neurologist for the brain fog.
Yep.
She just wants a clinic that will put the whole puzzle together on one single table.
But is the medical philosophy in Tijuana fundamentally different in how it builds that puzzle, or is it just, about getting longer out-of-pocket appointments?
Well, the length of the appointment is really just a byproduct of a profoundly different underlying philosophy. Standard domestic medicine often approaches Lyme disease by viewing the bacteria as the singular enemy. Right.
Just kill the bug.
Exactly, focusing almost exclusively on aggressive eradication. But integrative practitioners in these cross-border clinics, they shift the lens. They treat the patient as an interconnected biological ecosystem.
Oh, wow.
Yeah, their methodology heavily prioritizes identifying root causes and hidden variables within that ecosystem rather than just, suppressing the loudest symptoms.
That makes a lot of sense. They operate on the understanding that by the time a chronic patient reaches their doors, the collateral damage to the nervous system, the joints, the cellular mitochondria, it's just as devastating as the infection itself.
So to map out that damaged ecosystem, they obviously need data.
A lot of data.
Right. So the real work actually starts before the patient ever packs a bag or crosses the border. The paper trail is where the detective work begins.
Yes. Organizing those medical records is a mandatory first step. These clinics, they won't just glance at a one-page summary.
They want the whole history.
Everything. They require a comprehensive review of past Western blot or ELISA tests, CD57 immune panels, imaging, and highly detailed symptom diaries.
Honestly, I can imagine how exhausting that feels, having to dig up years of painful medical history and basically relive all those failed appointments when you barely have the energy to get through the afternoon.
It is a heavy logistical lift. I mean, it really is.
Mm.
And it is completely valid to feel overwhelmed by the sheer volume of paperwork. But the reason these clinics insist on it is to prevent repeating the exact treatments that have already failed you. When they look at your old blood work, they aren't looking at it the way a standard domestic lab does.
How so?
Well, for example, standard laboratories often only declare a Western blot test positive if a highly specific, rigid number of bands react.
Right, the criteria is super strict.
Very. But Mexican specialists perform a highly granular analysis of individual bands. They specifically look at like bands 31 or 39, which are highly specific to the Borrelia bacteria.
Oh, I see.
Yeah, they view these reactive proteins as vital, lingering fingerprints that tell the story of an ongoing immune struggle, even if your total count fell below that arbitrary reporting threshold back home.
Wow. And when reviewing that history, seeing multiple rounds of doxycycline or rifampin, it isn't just about noting what failed to cure the infection. It's essentially a map of the scorched earth left behind inside the patient's body.
That's exactly what it is. Knowing the antibiotic history provides a critical blueprint of the battlefield.
Because the doctors need to know what you've been through.
Right. The clinical team needs to understand the cascading effects of those past medications. Did the patient experience a severe Herxheimer reaction? How extensively did the prolonged antibiotic use damage the delicate flora of the gut microbiome?
It's just huge.
Massive. This data reveals the potential resistance profile of the remaining bacteria, the current fragility of the patient's digestive tract, and just the overall exhaustion level of the immune system.
Yeah, that blueprint is vital for planning the next steps without causing further harm.
Exactly.
And digging through that blueprint often reveals a much more complicated reality. I mean, most people in the chronic Lyme community already know the dread of hearing names like Babesia or Bartonella.
Oh, yes.
Ticks are often described as nature's dirty needles because they rarely deliver just one pathogen.
Unfortunately, that's very true.
But what happens when a domestic doctor spent 5 years treating a patient exclusively for the Borrelia bacteria, completely missing the fact that they've also been harboring like a malaria-like parasite the entire time?
See, that oversight is exactly why so many patients remain chronically ill. Borrelia, the primary Lyme bacteria, is an absolute expert at suppressing the host's immune system.
Okay, and when the immune system goes down?
When it's depressed, co-infections like Babesia, Bartonella, Anaplasma, and Ehrlichia are just allowed to rapidly multiply unchecked.
Let's slow this down for a second. That's a lot of medical terms.
Sorry, yes, it is a lot. So basically, treating the primary Borrelia infection while ignoring a parasitic infection like Babesia, which actually invades and destroys red blood cells, causing profound fatigue and air hunger, that inevitably leads to a rapid, devastating relapse.
Right, because standard oral antibiotics designed for bacteria don't kill bloodborne parasites.
Exactly.
It's like trying to fix a flooded house. If you dry the carpets but completely ignore the broken pipe hiding behind the drywall, the mold just comes right back the second you stop running the fans.
That is a perfect analogy.
You need entirely different tools for different structural problems. But if these co-infections are so prevalent, why are domestic tests missing the broken pipe for years on end?
Well, standard two-tier antibody testing relies entirely on measuring the immune system's response to an infection. It searches for the antibodies your body is supposed to create.
But their immune system is already suppressed.
Right. As we just noted, chronic Lyme patients often have severely compromised immune systems that simply aren't producing those antibodies anymore. The radar is essentially turned off.
Wow, so what do they do instead?
Facilities in Tijuana bypass these outdated indirect methods. They utilize highly sensitive PCR DNA testing.
DNA testing?
Yeah, which directly hunts for the pathogen's actual genetic material circulating in the blood or hiding in the tissues.
Oh, so they don't look for the footprint, they look for the actual shoe.
Precisely. They also utilize advanced dark field microscopy, which is often referred to as live blood analysis.
Live blood, like they look at it right then and there.
Yes. By using specialized lighting that illuminates the edges of cells against a dark background, doctors can physically observe the behavior of Spirochetes, the distinct, corkscrew-shaped Lyme bacteria, and parasitic activity in a live blood sample in real time.
I have to say, actually seeing the physical bacteria moving on a screen must be a profoundly emotional moment for a patient.
I've heard it is.
To sit in a chair after years of being told by local specialists that your labs are, normal or that your symptoms might be psychosomatic, and to physically see the invaders on a monitor, that kind of validation is massive.
It changes everything. The invisible illness suddenly becomes undeniable. And once the clinical team knows exactly what specific pathogens are hiding in the body, the strategy shifts to eradication.
Which brings us to the hardest part, right? Once you actually see these stealth pathogens on a screen, the challenge becomes eradicating them without collapsing a body that is already running on fumes.
Exactly.
How do you knock down the structural damage in our flooded house analogy without destroying the foundation?
This is the core of the integrative care approach. The objective is to systematically alter the internal environment of the body so that the pathogens simply cannot survive while simultaneously rebuilding the patient's cellular energy.
How do they do that if the gut is already destroyed from antibiotics?
Well, because chronic patients often have severely compromised digestive systems, these clinics bypass the gut entirely. They utilize advanced intravenous and systemic therapies instead.
Okay, so one of the core therapies heavily featured in the source material is whole body hyperthermia.
Yes, hyperthermia.
And honestly, intentionally giving someone a high fever sounds incredibly intense for a patient who is already completely drained of energy. How is that safe?
I know it sounds daunting, but the Borrelia spiracete is notoriously heat sensitive. Under normal circumstances, these bacteria evade the immune system by burrowing deep into joint tissue, the central nervous system, organs, and they wrap themselves in protective, slimy shields called biofilms.
Oh, right, biofilms.
Yeah, so during a systemic hyperthermia session, the patient is placed in a specialized thermal chamber, often under vivistation. Their core body temperature is slowly, artificially raised to around 106 degrees Fahrenheit.
Wow, 106.
Yeah, it simulates a massive natural immune fever.
And the heat essentially melts those physical barriers.
It degrades the biofilms and directly damages the thermal-sensitive proteins of the bacteria. But just as importantly, the artificial fever acts as a massive biological catalyst for the patient's own immune system.
So it wakes the body up to fight.
Exactly. It triggers a rapid, aggressive production of white blood cells and heat shock proteins. It is a highly demanding physiological stressor, which is why it is only performed under strict ICU-level medical supervision.
Right, with critical care, nurses constantly tracking the patient's heart rate, oxygen saturation, and core temperature.
Exactly.
But relying purely on temperature to kill a pathogen seems like only half the battle, right? The bacteria that survive the heat are now exposed in the bloodstream without their biofilm shields, but they are still active. You still have to clear them out.
That is where the blood oxygenation therapies come into play. Specifically, intravenous ozone therapy and ultraviolet blood irradiation, or UVBI.
Okay, let's break those down.
Sure. Lyme bacteria are fundamentally anaerobic organisms, meaning they thrive in oxygen-depleted environments and are actively destroyed by highly oxygenated ones.
So how does ozone actually interact with the blood to do that?
Well, ozone is essentially supercharged oxygen. It has 3 oxygen atoms instead of the usual 2. When medical-grade ozone is carefully infused into drawn blood before being returned to the patient, that unstable third atom creates transient oxidative stress.
Which does what to the bacteria?
It generates lipid peroxides. Healthy human cells have robust antioxidant enzymes that easily neutralize this brief stress. It actually causes their mitochondria to produce more cellular energy.
Oh, cool.
But anaerobic bacteria completely lack those protective enzymes. The oxidative stress punches microscopic holes directly in their cell walls, neutralizing them.
That is wild. And UVBI operates on a similar principle of altering the blood environment.
Yes. UVBI involves passing a small portion of the patient's blood through a specialized machine that exposes it to targeted ultraviolet light.
Literal UV light.
Literal UV light. This exposure actively damages the DNA of circulating viruses and bacteria, rendering them unable to replicate. And simultaneously, it modulates the immune system to recognize and attack the newly neutralized pathogens.
But wait, when you blast these bacteria using heat, ozone, and ultraviolet light, you trigger a massive Herxheimer reaction, right? The die-off effect.
Yes, the Hertz reaction.
You are suddenly flooding the bloodstream with dead bacterial fragments and endotoxins. I imagine that is a terrifying prospect for someone traveling abroad to suddenly experience a severe flare-up of their absolute worst symptoms. The exhaustion, migrating bone pain, severe chills.
It is scary. The Herxheimer reaction is an unavoidable biological reality of rapid eradication. However, Unlike standard care models that often leave patients to manage this die-off at home alone, integrative clinics build aggressive detoxification protocols directly into the daily schedule.
Oh, so they don't just leave you hanging.
It's not at all. They administer high-dose intravenous glutathione, which is the body's master antioxidant, to heavily support the liver pathways as they process the endotoxins.
Okay.
They utilize targeted lymphatic drainage massages to physically pump the metabolic waste out of congested cellular tissues. They employ customized peptide therapy for immune modulation and high-dose IV vitamin C to reduce systemic inflammation.
So they actively orchestrate the body's clearance of the debris.
Exactly. They support the body through it.
We also talked earlier about the scorched earth left behind by years of antibiotics. Starving the bacteria and oxygenating the blood is vital, but if 70 to 80% of the human immune system lives in the gastrointestinal tract, you have to rebuild the gut, right?
Absolutely. Nutrition is not treated as an afterthought. It is a primary medical intervention. Chronic infections thrive in acidic, sugar-rich environments.
So what do they feed you?
The clinical nutritionists immediately place patients on strict anti-inflammatory low glycemic protocols. By entirely removing refined sugars, gluten, and conventional dairy, they starve the pathogenic bacteria of their primary fuel source.
And I guess that also radically reduces the overall inflammatory burden on the patient's aching joints.
Yes, and it allows the damaged microbiome to finally begin regenerating.
It's a massive, multi-front biological approach. But, let's step back from the science for a moment and look at the reality of being a patient.
Okay.
Planning all of this while dealing with chronic brain fog is like trying to plan a complex international wedding while you have the flu. It's just too much. How does a patient keep all this straight without crashing before they even get to the clinic?
That's such a real concern. The logistics of medical tourism can be daunting, but it's important to understand that the specialized medical districts in Tijuana are fundamentally built around caring for individuals whose bodies are highly sensitive and depleted.
Oh, so the infrastructure reflects that.
Exactly. For example, the border crossing is heavily streamlined. Many accredited clinics offer secure, private shuttle services that pick patients up directly from the San Diego airport.
That's a relief.
And Tijuana features a dedicated medical fast-pass lane, specifically designed to expedite the safe, rapid crossing of international patients, completely bypassing the standard border traffic.
Wow. And what does a patient actually need to pack for a multi-week intensive program like this? I mean, it sounds like you are going to be sitting in clinic lounges receiving IV therapies for hours every single day.
You are. So comfort and utility are the priorities. Patients need to pack loose, comfortable clothing with easy access to the arms for daily intravenous lines.
Right, makes sense.
It is absolutely crucial to bring all current medical records in physical, printed form, not just digital copies.
Just in case the Wi-Fi drops or something.
Exactly, to ensure immediate access regardless of technology issues. You should also bring personal hygiene items, free of harsh chemicals or synthetic fragrances, because the detox process makes the body highly sensitive to environmental toxins.
Oh, that's a really good tip.
And while it isn't strictly mandatory, bringing a trusted companion or family member is heavily recommended. The physical demands of the detoxification process, combined with the emotional weight of treatment, make having a daily advocate invaluable.
Speaking of being an advocate, patients really need to feel empowered during the research phase. They shouldn't just accept the first clinic they find. What specific questions should a patient like Emily be asking these facilities before she ever commits to a treatment plan?
Due diligence is critical. Patients should be directly asking the clinical coordinators things like, exactly how will your medical team review my prior tests?
Right.
Will your initial diagnostics specifically evaluate for stealth co-infections like Babesia and Bartonella? What is the daily nurse-to-patient ratio in the IV lounge? And crucially, what does the transition home look like?
That last one is huge, because you don't just finish a 3-week intensive protocol, pack your bags, and say good luck. The healing continues long after you cross back over the border. Returning home has to be a formalized part of the plan.
Reputable centers build that into the protocol from day one. Patients do not just leave, they are discharged with a highly structured transition plan.
What does that include?
It includes scheduled telemedicine follow-ups with their integrative doctors, a customized, phased at-home supplement and dietary protocol to maintain the gut health, and translated, highly detailed medical records.
Oh, that's amazing.
Yeah, this continuity of care ensures that their local domestic doctors can clearly understand the biological progress that was made and successfully co-manage the ongoing long-term recovery.
But again, this goes back to my earlier point about the sheer exhaustion of chronic illness. Doing all this research, verifying the accreditations, finding the right clinic, asking these complex medical questions, managing the border travel logistics.
A lot.
It is a massive logistical mountain for someone whose primary goal each day is just finding the energy to get out of bed.
This is where having organized information can help, and having a dedicated health advocate becomes absolutely essential. A platform like PlacidWay is designed specifically to lift that logistical burden off the patient's shoulders.
Right. They help you sort through it all.
They do. PlacidWay helps individuals seamlessly compare Lyme disease treatment options in Mexico. They ensure that patients are connecting strictly with internationally accredited clinics and board-certified functional medicine specialists.
So they act as the initial filter because patients really shouldn't have to be their own private medical investigators.
They handle the heavy lifting. PlacidWay facilitates the secure transfer of your complex, multi-year medical records directly to the clinical team for review before any commitments are made.
Oh, that saves so much stress.
And they help you review transparent, all-inclusive bundled packages so you understand the scope of care without hidden fees. Most importantly, they help arrange those preliminary telemedicine consultations.
So you can actually talk to the doctors first.
Right, allowing you to ask the hard medical questions and request a free quote. They manage the complexities of admission so you can conserve your limited energy for the actual hard work of recovery.
Honestly, a lot of patients are not looking for big promises. They're looking for clear answers. And honestly, feeling heard matters. When you have been dismissed for years, sitting across from a medical team that looks at your tangled history and says, "We see your labs, we understand the co-infections, and we have a comprehensive plan to rebuild your system," that validation alone is a massive step toward getting your life back.
Validation combined with precise, integrative action is the foundation of true healing.
If this topic connects with what you were exploring, you can use PlacidWay to compare Lyme disease treatment options in Mexico, ask questions, and request a free quote when you are ready.
Consider this.
Ah.
What if the ultimate key to long-term healing isn't just about fighting an invisible invader, but fundamentally changing the environment within your own body so that the invader simply has no place left to hide?